Hi, I'm Heather Parsons, Vice President of Federal Affairs and Regulatory Policy at AOTA. Now that H.R. 1, or the One Big Beautiful Bill Act, is passed, I wanted to briefly talk about two of the Medicaid provisions in this bill that are most likely to impact occupational therapy and then discuss the next steps. One of the changes in the bill expected to have the biggest impact are the new Medicaid work requirements. So beginning in 2027, in the 40 states that expanded Medicaid under the Affordable Care Act, certain Medicaid enrollees will need to prove they're working, volunteering, or in school for at least 80 hours a month in order to stay enrolled in Medicaid. These requirements won't apply to people over the age of 65, those with serious medical conditions, those who are pregnant, or people who are caregivers, both to someone with a disability or to children under the age of 13. But many of the people in these exempt groups will still have to submit paperwork as proof of their eligibility. The Nonpartisan Congressional Budget Office predicted, from their past experience with work requirements, that the paperwork burden alone could cause many otherwise eligible people to lose Medicaid coverage. This is especially concerning for some of the people we serve who may be experiencing unstable housing, have a mental health or substance use disorder, or a non-qualifying disability. Separate from the new work requirements, the bill includes major cuts to state Medicaid funding, more than $300 billion over 10 years. About $191 billion of those reduced payments to states comes from a change to something called the provider tax, which is a complicated system that states have used to boost federal funding in the past. Provider taxes, more importantly, were also used to increase payment rates to providers, especially those like hospitals and skilled nursing facilities, in order to help offset those otherwise low Medicaid reimbursement rates. So these provider taxes have been capped or decreased depending on which state that you're in. Because rural hospitals and SNFs may be hardest hit by the changes to the provider tax, and because these same hospitals and skilled nursing facilities may be the most impacted by the predicted increase in the number of people who are not insured, the bill does include some extra funding for facilities in rural areas. However, not all facilities impacted by these changes will be eligible to receive the funding. So in the next step, the Centers for Medicare and Medicaid Services, or CMS, will be responsible for writing the rules and issuing guidance to states on how to implement these new requirements. These rules will shape how states interpret and apply the law, and they could significantly influence how burdensome or flexible the new work requirements become. AOTA will be actively engaged in this process. We're going to be submitting comments, meeting with CMS officials, and advocating for implementation strategies that are the least burdensome and the least likely to have people accidentally fall off of their eligibility, even if they meet the criteria. At the same time, we're also going to be working closely with the state associations to respond to funding cuts and to the policy changes that are mostly going to occur at the state level. We want to ensure that occupational therapy remains accessible and that reimbursement reflects the value of our services. AOTA will be there supporting you and the people who you serve. I want to take a moment to add, we are incredibly grateful to our AOTA members, as you are the one who make this work possible. Without you, we wouldn't be able to do this work. So everyone, please stay tuned for more updates and resources from AOTA. Thanks.